Okay, so hello, welcome to our first focus session for Bio 202. I'm just going to kind of go over some general information about the sessions, kind of what to expect, how these are going to kind of flow through the rest of the semester, and then also talk about how to get credit for these, especially if you're joining remotely. Okay, so the first thing about the session is just general info. Dr. Curley is giving 50 points for you attending 7 out of the 12 sessions that I host this semester. If you attend none of them, you'll probably do fine grade-wise. But if you want to get score an easy 50 points for your overall semester grade, you just have to attend seven out of the 12 sessions. I might host more depending on how the semester goes, or if there's certain weeks where I feel like we could maybe do another session. But for now, as long as you attend 7 of them, you'll get your full credit. I'm taking attendance as we go. That way, I have you down. If you are joining me remotely or watching this later on YouTube, that's okay. I'd rather you get the information than you not being able to attend. At the very end of this slide, I have a keyword, and so if you're watching this remotely, you're just going to email me once you're done watching it and tell me the keyword. This one will be pretty easy. It's going to be on a slide. After this, some other sessions might have me sprinkle it in during the discussion. And that way, I just know that you're paying attention to what we're talking about here. For the most part, you can attend in person, live Zoom, or through a YouTube recording at your convenience. Like I mentioned before, it was a pretty good split between half the students wanted to do this in person, half wanted to do it live on Zoom. So I'm going to just do both. So after lab on Tuesdays, I'll stay behind, do the study session. If you can stay and do that in person, that's great. If you need to go to another class or do whatever, you can always leave, come to the live Zoom session or watch the recording later. I also include exam reviews for the focus sessions. So next week I'll be doing our exam 1 review because as you can kind of see here, endocrine exam for lecture is going to be coming up next week. So I'll be doing the exam 1 for next week. Um, and so feel free to join me next week, especially if you're just watching this for the first time. General etiquette, if you have any questions, feel free to raise your hand or throw them in the chat. If you have any questions via the recording, please just message me or Dr. Curley, and we can answer those as we come along. Okay, so the first thing I want to start with, honestly by now, because lecture is kind of at your own pace on the hybrid side, you should at least be through sections or topics or outcomes, outcomes 1 and 2. Ideally, you're starting on outcomes 3 through 6 this week, and that'll give you all of next week to review, ask questions, and get ready for the exam. In general, I'm going to cover kind of a way you can organize the endocrine system. A lot of it is mostly physiology based. It's not really anatomy. There is some anatomy that's involved. You can kind of see in the picture here some of the big things that we look at: the hypothalamus, the pituitary glands, and then the pineal glands. Pretty nice to have, but the ones that I would always focus on are the hypothalamus, pituitary glands, both anterior and posterior, the thyroid gland, and the adrenals or the adrenal gland. All the other ones are fairly straightforward. They're very small in terms of glands and what they do for the body. But the big ones are hypothalamus, which is your controlling mechanism for your endocrine system. The pituitary glands, both anterior and posterior, which release a lot of your inhibiting and releasing hormones. And then your bigger glands that affect system-wide are the thyroid and the adrenal glands. One of the topics that students do struggle to understand is the concept of the hypothalamo-hypophyseal system. This is the way the hypothalamus talks with the pituitary glands. So depending on the pituitary gland, the hypothalamus is going to communicate two different ways. For the hypophyseal tract or hypothalamo-hypophyseal tract system, it involves the hypothalamus and the neurohypophysis or the posterior pituitary. So oxytocin and ADH, they are what we call neuro hormones. That's not a term you're going to hear in this class. It's a little bit higher level, but for the most part, these are chemicals that act like hormones. So they travel through the nervous system, and they arrive in the posterior pituitary gland or the neurohypophysis, and they circulate and they stay in the system, and they wait for the body to need them. So ADH or antidiuretic hormone is used in the body to retain water. You don't always need to retain water, but it's something that the body does try to do, especially as you're trying to use the bathroom and you need to urinate. The body will always do a last ditch effort to save water where it can. And in the meantime, ADH stays in the pituitary until it's needed. Oxytocin is very similar. We don't always need oxytocin. We know oxytocin is known for being a love hormone. So when you are seeing your loved one or your partner, your pet, your family, your child, the oxytocin hormone is used to kind of create that bond. And it's very important for both mothers and children to develop that mother-fetal relationship. But for the most part, you don't need it all the time. So it'll stay in the neurohypophysis, it'll concentrate there, and then when the body needs it, then it gets secreted into the blood system. So oxytocin and ADH are both produced by the hypothalamus. They are concentrated in the neurohypophysis, and they are then secreted by the neurohypophysis or the posterior pituitary gland. And I'll show you how I broke that down in another slide. On the anterior pituitary side, you have what we call the hypothalamo-hypophyseal portal system. Now, the term portal in biology or in anatomy is usually referring to the blood system. So the hypothalamus will release seven either releasing or inhibiting hormones that tell the adenohypophysis to make other hormones to do other things. So there was a question on your endocrine chart, question one, asking you about the releasing and inhibiting hormones. The general definition of that is we have hormones that tell other parts of the body to release other hormones. So the gonadotropin releasing hormone, corticotropin releasing hormone, prolactin inhibiting hormone, those hormones, they kind of have inhibiting or releasing in them, will go to the adenohypophysis or the anterior pituitary gland, and it'll tell it, I need you to produce these other hormones to then go do these other things. And those other hormones get released into our blood system. They travel to whatever organs they need to go to, and then they'll actually act on the body. Now, one of the things that helps with this system, because it's very physiology heavy, is kind of understanding where everything goes. So the chart that we had you fill out was there to help you kind of start organizing information. But I know that some people don't like the chart, some people love the chart. The way you can do this best is to try to group it into ways that'll help you understand. So I want to show my example. This is how I grouped it when I was a student in Bio 202. I like getting the big whiteboards at the library, and I just kind of have all this room. I can start filling it out. So you can kind of see on the left, I decided to group both the posterior pituitary and the anterior pituitary glands. I put hormones produced by the hypothalamus in orange. So you have ADH, oxytocin, you have the growth hormones, you have the gonadotropin releasing hormone, you've got prolactin releasing and inhibiting, you have TRH and CRH. Then I decided to separate by what is secreted. So posterior pituitary gland secretes ADH and oxytocin. I put where they act on. So ADH acts on the kidney to retain water. So if you can get your hormones into where are they produced, where are they secreted, where do they act on, and then what do they do, like a general one sentence, two sentence description, that'll help you piece this together a lot better. Personally, I like having one page that if I have a 15-minute break, I can go to this one page, look at all these different hormones really quickly, and then go do something else. When I have to skip through different pages to find stuff, it always makes it harder for me to study. So kind of like the example I have here, you can kind of break it apart. You can see here on the AP or anterior pituitary gland, I know that the hormone is still produced by hypothalamus because I have it in orange. I know that the hormones in orange are secreted by the hypothalamus, and it causes the anterior pituitary gland to then produce these hormones in red. So things like follicle stimulating hormone, luteinizing hormone, growth hormone, prolactin, ACTH, or I forgot what ACTH stands for, but you can kind of see the hormones there, and then I write down where they act, and then for example, I'll use TRH. So TRH acts on the anterior pituitary. So again, it goes through that portal system. Hypothalamus sends TRH to the anterior pituitary gland. It then tells the anterior pituitary gland, because it's a releasing hormone or inhibiting hormone, I need you to release more TSH. The TSH it's released or produced by the anterior pituitary gland. It then acts on the thyroid to make T8, T3, and T4, which is involved in metabolism, growth, and temperature regulation, and also releases calcitonin, which reduces calcium in the body. It also indirectly affects the parathyroid, which releases PTH or parathyroid hormone, which will then increase calcium in the blood. And you can kind of see how just with TSH alone, you can regulate calcium in the blood. Either the thyroid reduces calcium using calcitonin, or the parathyroid increases calcium using PTH. So I was able to take all that information and group it into this one line to make it easier for me to study. One of the more important ones that we have is a CRH. And again, I don't remember the long word for the abbreviations. I typically study the abbreviations only. That's because it's just easy for me to study. But that is, again, produced by the hypothalamus, acts on the anterior pituitary. The anterior pituitary then makes ACTH, which impacts the adrenal gland or the adrenals. You have two parts of the adrenal gland, the adrenal cortex, which is what we consider vital, and the adrenal medulla, which is what we consider non-vital. Back when I was a student, we used to call the adrenal cortex, or the vitals, were the salt, sugar, and sex. So salt is regulated by aldosterone. And what salt does is if you have extra salt in your body, water likes to balance things out. So if I have a very salty blood system and a not as salty outside, like let's say my digestive system, then water will want to stay in my blood. And by keeping water in my blood, you one increase sodium retention, but more importantly, you actually increase your blood pressure. So aldosterone is very useful if you need to raise or maintain your blood pressure. Your body will tell your body keep salt in, which keeps water in, which then raises your blood pressure. Sugar, that's regulated by cortisol, and that just increases blood glucose levels. And you can kind of see up here how the pancreas helps regulate blood sugar by either reducing or increasing glucose in the blood. And then the adrenal cortex is also involved with releasing things like testosterone and estrogen, which if you look at the very top line, the gonadotropin releasing hormone, that is also involved in telling the gonads, which is either your ovaries or your testes, to then produce more testosterone, more estrogen, or progesterone when you're pregnant as a female. You're more than welcome to take a picture of this. Obviously, you have the live video. I do encourage you to come up with something similar to this if it works for you. I've also seen people use note cards. I've seen people draw things. Whatever works for you so you can memorize the information, I do encourage you to do that. I just wanted to show you one way that you can do it as we prepare for the exam. The last thing I'm going to cover for this session is there an exam study guide? So every lecture does have an exam study guide. Well, the way you can find it is by going to your module section in your Canvas course, going into lecture for the specific system, in this case, endocrine. Go to Unit 1, Intro Competencies and Exam Study Guide. And if you open that up, you'll see download the endocrine system exam study guide. Next week, when we talk about the exam to practice for it, I'll talk about how you should use that exam study guide. And more importantly, I also like to flag, I'll call them my top 5 or top 3 of things that, if you have 15 minutes to study for this exam and no other time, I would look at these 5 things to give you the best chance of doing well on your exam. But go ahead and take a look at that. There's a list of, I believe it was 15 or 16 different items on there. A lot of those, if you actually read them and go back through it, a lot of it is this right here. It asks you, do you know the hormones that are produced? Do you know where they're secreted? Do you know where they act? And then do you know what they actually do once they're released in the blood system? Other than that, if you are watching this through the recording, the keyword today is pups, which is my dog who's just laying right next to me. She's kind of waiting for me to finish up. So keyword is pup. So the way you're going to do this is once you're done watching this video, please message me on Canvas and then just say, I watched the video, keyword is pups. And if you do that, I'll give you credit for attendance for this session. If you're here in person, you don't have to do any of that. I've already got you down for attendance. I have Michelle, Mia, Lupita, and Candy. So I've already marked you off for that. And so you don't have to do anything else. Besides that, that's all I have for this small focus session. Does anybody have any questions? Okay, if you don't have questions now, or if you have questions later as you would watch this, please let me know. Other than that, thank you for joining, and I will see you all next Tuesday.
Okay, thank you.
Yeah, thank you.